In the city of Chicago, the life expectancy of African Americans is alarmingly low. Why is that? What are we doing about it? I'm Sylvia Snowden, and this is Critical Condition. The Chicago Department of Public Health has just released its very first study on the state of health of Black Chicagoans. And spoiler alert, in case you were wondering, the news isn't all that great. So here to talk with us about some of the findings of the study, as well as what Black Chicagoans should be taking away from this data, is one of the authors of the study. Before I get to her, though, I should say that I'm Sylvia Snowden. I'm a very proud employee here at CAN-TV, and I'm thrilled to welcome to today's program, Yaa Simpson. Hello, Sister Yaa.
Hey, Sylvia, how are you?
Well, you know, I was doing okay until I read this report. Yeah, there's a lot happening.
Yes.
Black people are not in great shape. So why don't we start by having you tell us what's going on with us? Well, what did you find in this study?
Okay, so thank you. First of all, I want to thank CAN-TV for even allowing us to really engage with the community through your medium. And I am a huge supporter of CAN-TV. And by the way, as your favorite community epidemiologist, I must caveat and say I am at this point not representing the health department, although we're going to talk about the report. I'm representing T.A.C.T.S, the Association of Clinical Trial Services. And so that way, you know, we're doing things in right order. But your question is still a public health question. Why are Blacks' life expectancy not at par? What is going on that there's 9.2 years difference between Black Chicagoans and non-Black Chicagoans? And guess what? It gets even worse than that. There is over a 7-year difference nationally. So when you look at the United States life expectancy data that just came out from CDC in July. They released what they call a mid-year life expectancy model. And the life expectancy for Blacks was 7 years different. No matter where we look at it, whether it's local, whether it's national, Black people are dying earlier. In fact, premature death. So what does premature death mean? That means dying before the age of 75. So whereas other people are living to 80, 83, Blacks are living to 70, 71. In fact, all that data is pre-COVID or pre-2020. So that means it's going to be even worse for 2021, 2022. What is driving the life expectancy for Blacks to be so much worse and poor?
And that was going to be my next question. Like, why? What are we doing in a city with so many different people? How is it Black folks can't make it to old age? What's going wrong with us?
So there are, as I was starting to say, multifactorial reasons. And that is just a big word for saying, girl, it's a lot of issues. The first issue we always deal with, unfortunately, is chronic diseases, because that is at the crux of things. It's hypertension, strokes, cancer, chronic diseases is right there. Diabetes, obviously, but dying from it is the issue. So most of our problems of not having a better quality of life is having disease or chronic illnesses within our community. Another issue, unfortunately, is infant mortality. Again, another death. After looking at infant mortality, we think about the opioid deaths. We're also having to talk about what you say homicide. We say homicides, you all call it violence, but it is death from violence. And then we have infectious diseases on top of that, such as HIV, hepatitis, and yes, COVID. So here it is, we've got chronic and infectious diseases that impact us, but then we have these social determinants like the opioid epidemic, like mother and infant mortality. And then, of course, unfortunately, we do have to, talk about the construct of violence in our community. And these are the 5 top drivers, not the only ones. I mean, there's other things like mass incarcerations. There's other things like not being able to have good quality care for where you live and the housing that you have. It's not about the expense of the house, it's the quality of the environment of the house. If you got roach spray everywhere, if you got rat feces everywhere, mouse feces everywhere, you're inhaling that and having asthmatic issues, your quality of life is not the same. So you see how I just took it and made it into an onion. It ballooned out really quick. And each one of those drivers I just mentioned can have his own book.
Yeah, and all of that surprised me really because Chicago is known, frankly, as a bastion of Black excellence. You have
Yes.
here, we've had Black mayors, we've had Black states attorneys. The first Black president came out of Chicago. Chicago has a
Yes.
Black middle class. Chicago has a Black upper class. So how is it that Black people can be doing a lot better than Black folks in a lot of other parts of the country here? And this still be true? How can we both be doing so well and be doing so poorly all at once?
And so to really hone in on your question, and I thank you for that litany about all our elected officials who are Black. Chicago has more representation in the political world for Blacks than most other cities in the United States. Yet in comparison to whites, it still ain't high as theirs. See, that's the difference. You're looking at the excellence at our level, and we're like, we've got all this, but they're still not controlling the purse strings. We're still not earning the same amount as others, especially whites. In comparison, white people in Chicago are doing even more stellar than us. So when you look at that comparison, at least we're at the 71 mark. In some places in the Chicago area, like if you were in Inglewood or out west, your life expectancy actually diminishes. It's at 69, 68. You can live 10 blocks away from the L station or CTA and have a different life expectancy just based on where your zip code is. And we are questioning, why should that make such a difference? Well, cost of living, income, and social determinants within the construct of environment. So how you live with people around you. Are you living in stressful environments, or are you living in environments that are more appeasing to your health and well-being?
Now, it's worth noting that Mayor Lightfoot read your report and decided to declare racism a public health crisis here in Chicago. And I wanted you to address that. Is racism killing Black people off in Chicago?
Absolutely. So as an epidemiologist, I do have to say, we cannot measure in a metric racism. So we use proxies like life expectancy. I was elated that, let's take the politics out. We got enough issues with politics and public health, honey. I don't know what's going on with that. But I was elated to know that the mayor actually did read the report before even, seeing us. And that's a step in the right direction when your elected officials are actually reading your report. And then she did some action by calling it racism as a health crisis. But unfortunately, we can't give you that variable and say, well, here's racism and this is how much is impacting us. Therefore, it leads to lower health outcomes or worse health outcomes, lower life expectancy. It's just not that simple. It's far more complex because our life and living is like with Dr. He's a doctor out of Harvard University. Dr. Williams, I believe his last name is, from Harvard University. He had the best explanation I ever heard. You ever seen like you have a rock that's solid, but you have a one drop of water just hitting that rock every day, all day, every hour, second, minute, and it's just hitting it. And he uses that to call it weathering. And when you weather, even you can break a rock with water. We've been broken down.
Well, okay, well, let's break some of that down for a second, because I know there are people who are watching who will say, listen, it's not racism killing Black people, it's Black people killing Black people with all these shootings happening in Chicago. So, and I want you, because I'm so happy that you are an epidemiologist and you can explain this from an epidemiological standpoint. Talk about how violence is, in fact, a disease that can spread from person to person to person, like any other disease in a city like Chicago. No, seriously, because a lot of people think violence is a character issue or a moral flaw and not, a disease. So please explain to us how violence can be a disease moving from person to person to person like any other ailment.
Violence as a disease, and in my line of work, it would be an infectious disease, is not so much about just one person as much as it's about the impact on several people. Just like a virus would have an impact on what? Not just one person, on several people. So some people like, well, I can't catch the violence. No, you can't catch it like a cold, but you would be swept up in it if it was a retaliation from a family member and then all of a sudden you're involved and you had nothing to do with it. Violence pulls over the population of people because it impacts so many people at once. It's not just those two individuals going at each other. It's actually groups of people who don't even know that they're connected through that violent acts. So when we talking about violence, we're talking about hurt people hurting people. And that is the cycle in which we look at it as a dis-ease. That when you took care of the person that was the least of these and you brought their health up, you improved their health outcome, the people with the most of these actually lived better. And the less that there was a gap, the better that the place would fare out. Some modern examples of that is actually, believe it or not, people living in Japan. They have more sentinel beings, in other words, people living at 100 plus years, 103 years than anybody else, around. There are some islands actually who have people that are living in Caribbean islands, Black, who have people living to 105 years old and they're poor as all get out. The difference is their quality of life is better because they're not as stressed, they don't have as many health ailments, and they're not as discriminated against racism as in other places. So their quality of life tends to be better. And that's statistically and researched, evidence-based, proven.
Okay, I'm going to bat that back for just 2 seconds because there are people who I'm not who will say, well, listen, a lot of people have been subjected to racism who never shot anybody, never stabbed anybody, never fought anybody. So how can you blame that on violent behavior in Black communities?
Again, in the construct and in your question is how can we blame it? We're not blaming it, we're pointing it out, and it's just one of many. It's like anything else. You're not built by one cell, you're built by many cells. You're not built by one health system or one system of the body. You have 12 systems in your body, and if one of those systems don't work, your whole body will feel it. It's the same construct here. If one part of us is violent, then our whole body is going to feel it.
You also spent a fair amount of time in the report talking about poverty and
Yes.
how that impacts health.
Another part of the system.
Yes. Share some of that with our viewers. Firstly, the state of Black people in Chicago. I say many of us are living well, but you say there's a lot of poverty in our communities. And then you say that has outcomes that impact our health. So break that down.
Absolutely. The first thing we do is talk about income. I mean, let's be clear. You have to eat to live and you have to buy food and have shelter, right? I mean, you all know that as Maslow's hierarchy of needs, right? If you don't have enough income, and that we use the word income based on what was coming into the household, so it's a medium-based income. And if you're not out of what we consider, it's a baseline for that. Like if you're a family of four and you're only getting $20,000 in the house, that is considered poverty. You're below the poverty line, as an example. If you're one individual and making $20,000 a year, then technically that's still poverty too, but you would live a little better because you'd have more resources. One individual. So then we have to talk about Blacks. Are they living as one individual or are they living as households or families, right? We tend to have a lower age that means a median, if you want to go, the median age for Blacks overall is more Blacks that are less than 30 years old as compared to Blacks who are older than 30. So that's just one aspect. But why is that important? Because that means all the children have to be taken care of. And if they don't have an income coming in, the household is poor. So people like Cory Brooks and other Congress people are considering raising the bar for poverty by getting children out of poverty, which would then have a direct impact on the families that are in poverty, whose life can be more improved. That is a solution that can happen. Like I just mentioned, there are other places and spaces in the planet where the people are impoverished. They do not have the resources. They don't even have the income, not even 20,000. There is no middle class. There is no social net. Yet they're still outliving us. And you know why? It goes back to poverty and racism. The racism, the stress of their living is different. They may be poor, but they're not being told every day they're nothing. They're, less than, they're subpar. They're not experiencing the weathering, if you will.
Okay, well, I'm not afraid to go a little deeper because as I was reading the study, I certainly couldn't help but think you're talking poverty, you're talking oppression, you're talking racism, you're talking violence. How much of this is still Black people carrying the plantation experience with us? How much of
Oh,
that
absolutely.
is happening?
Absolutely. Oh, okay. So what you just referred to, which is not in the book, but one day I have another excerpt from the National Black Agenda Consortium where I do mention a little bit about epigenetics. So you're saying, well, yeah, why are you telling me about some epigenetics? What does that have to do with my question? Everything. What you just mentioned, epigenetics is the study of how genetics and over time we inherit what our parents have gone through. So, in other words, I'm born into this world with an inflamed immune system because my people were already traumatized before I even came out the womb. Epigenetics actually studies that to say that you are a product of your ancestors. Therefore, what they carried, you carried. Then that means I inherit that in my body. Now, my cells got to get used to having this inside me, and we didn't do what it took to heal it. So, again, my first comment was hurt people, but hurt people are born into it as well, and they keep it going, and it's a cycle. Epigenetics uses the construct to say if you don't stop the cycle and heal it, it will continue generational.
Wow.
Is
Okay.
all of this starting to see a connection?
Well, this is fascinating. It was a really eye-opening study to sort of see everything laid out the way in which you laid it out, particularly because a lot of people commonly believe that a lot of the stuff you talk about in the study is the result, frankly, of poor personal choices. We talk about high HIV rates in our community. That's a choice to have unprotected sex. We talk about diabetes, chronic disease, heart disease. That's a choice to have a poor diet. We talk about gun violence. That is a choice to pick up a weapon and solve your problem violently. And if we made better choices, we wouldn't be in this position. So what say you then to the personal choice crowd who says that that's really where all this begins and ends with you, the individual, and your choices?
Well, I would have to tell them that that is not the reality, whether they think it or not. The reality is I didn't choose to be discriminated against. I didn't choose to have subservient food in my neighborhood. I did not choose to not be paid at the equal levels just because I'm Black. I did not choose to have subpar education just because you said I shouldn't even be able to read. I did not choose to say that my community should be less than your communities because when I did do better, you bombed me. You took my stuff. You, as in whites in this country and others, have discriminated against me over time for years. I came to this country majority, even though everybody didn't come as slaves, but we were enslaved and we was what you would consider subjugated to their laws. It used to be legal to hang us. Did you know that? It was legal. That was the law. It was legal to kill me. legal, because if I ran away from your house and you didn't want me to go and you owned me, you had that right. I wasn't considered a full human. It was legal to call me 3/5 and not even allow me to vote at one time. And even as a woman, took even longer. Black women took longer to be able to vote. So when people start telling me about the I says, no, honey, if you take the I away and put in we, even illness becomes wellness. That's one of our quotes in our book.
It sounds like the problems that we're having are about 450 years in the making, frankly. So how long do you think, if that's how long it took to get us in this mess, how long do you think it'll take us to get out of it and begin to get back on the right track with our health outcomes?
Absolutely. So I hear what you just did, which was the comparison of time. If you've been so far behind, how do you catch up? And if you would want to say quickly, we need some quantum leaps, right? We need some bypassing of 20, 30 years in a year. And to some extent, you would be right, because the way to improve is to have those types of quantum leaps, is to project something that if it took you 20 years to get here, how many years more is it going to take you to get there? That's what you're trying to say, improvement. And if you leave everything as is, it would take you 20 years. But if you improve those things, then you get to exponentiate. So, what are some of the ways that we would improve, right? Using technology. So, we're going to use technology, we're going to use our best practices, and we're going to use different perspectives. Like, instead of calling everything health inequities or health disparities, we're going to say health equity, and we're going to use a construct that works for us, not works for everybody, that works to improve us. And so by having that specific focus, that laser focus, you now propel us quicker than what we got it in. Now we can move exponentiated to get out or to improve. And improvement should be something that's every year.
So what would you like to see Black people do now that this study is out here and now that we've put it out for the viewers at home? Instead of just turning off the TV and going, it's too bad, what do you want to see us do as a result of this?
To be honest, off the top, I want to see y'all go after this dismantling of racism, because to me that's the variable that's not in the book, that's in the book, that would have the most impact on our health outcome. If we can even dismantle and reconstruct our healthcare system, as in, I am saying out loud, universal one single payer health systems have turned out to work better. We may not have to like Cuba, but their life expectancy is equivalent, if not better, than ours. And they only have one system. Canada, one system. South Africa, one system. So when you have a one system health unit, it tends to, as I told you in the beginning, raise the bar. So I would want people to start really advocating for not just health insurance that covers you, but health systems that heal you. We're treated, not healed. We need to hold that accountable. If you've been treating me for 30 years and I have the same illness with the same affect, with the same outcome, I don't need you, right? I mean, what physician you've done me no good? We need to start rethinking about what it means to treat versus what it means to heal. And what's the root word of health? Heal. We need to change how we think about health. Health is not just a right. It's not just a right and you're born for it. You're required to have it. So why can't it be improved just because of my color? No, we need to push back on that, clap back on it, dismantle that. And those come in the policies and laws, because I already told you, it used to be legal to hang me. You could hang me legally. So now I've come from under that. Now I got to make laws that says you have to treat me with quality. And if I'm not getting better, you're fired on to the next physician, on to the next provider. What do I want us to do? Start reacting to these people that have said they've been treating us and we're not getting any better.
Okay,
And we
so
do have to do some balancing on our own. We have to stop, the violence in our communities because we're enacting it because we're upset. So we need to deal with our hurt and start healing ourselves. We can't keep looking to them to heal us. You got to heal from within inside and then teach other people how to be healers. So we need to replicate healing and we need to replicate our own systems that serve us. We've been the best people to do that on the planet and we can do it again.
Okay, and so to close us out here, because I'm sure there are some people who will watch this and say, well, gee, I'm really sorry, Black people are not living long lives, but I'm not Black, so that's not really my problem. What do you say to those people who don't really feel like this is their issue because they're not Black?
I say to them, they're privileged because the distribution of wealth that they received, they didn't earn it. They got it because of their privilege. My people worked in this country for free. You will never be able to say you've outdone anything. Everything you got came from my ancestors. You did not get it on your own. And if you continue to allow an injustice anywhere to happen, it's an injustice everywhere that's happening. Martin Luther King. That injustice impacts you whether you know it or not. For example, you say the sun rised. Guess what? The sun didn't rise. You did. If that sun moves an inch out of the way, it will incinerate this planet. So your perspective is what has to change. And all hands on deck. In that book, we have a call to action. And that call to action is not just understanding health equity. It's not just acknowledging racism. It's not just demanding more money. It's not just making sure that you are dealing with, health equity. There were 4 calls to actions. We want to make sure that I say dismantling racism, and that's every sentinel being on this planet has to work for that. Because if the least of these are taken care of, then the most of these will surely be okay.
Well, okay. So with that, I think I'm going to close us out here because we have gotten through a lot. We've learned a lot. And I think that everybody here who's seen the second certainly has a lot to think about. So to our special guest, epidemiologist Yaa Simpson, and author of this study and president of T.A.C.T.S, we thank you so much for making the time. Truly, we've learned a
Thank
lot.
you. And again, if anybody didn't know that if you didn't get the book, I do know that you can go to chicago.gov and just type in, Black health, and the book will come up, the PDF will come up, and you can download it for free. So just say chicago.gov and then just search Black health and it'll come up instantly. You get it for free. And I encourage people to not just read that book, use that book. Stop telling us what you can't do and tell me what you can do. And everybody can do something.
Okay, yes, you can certainly go there and download that book. And I encourage everybody, if you have not read the report, please do check it out. Truly eye-opening information in there, very sobering. We've also done a very in-depth discussion on this topic with several of the authors of this study. You can find it at cantv.org. We'll be happy to share more information there. Please do go check that out there. You will also learn a lot from that conversation. Thank you all so much for watching. We are just beginning our deep dive into the state of health of Black Chicagoans here. So do hang out with us. So much more to come. We thank you and have a fantastic rest of the day.